fracture or possible assault victim. Police are on the scene. The scene is when you arrive, law enforcement is waving you over toward them. They're standing over the patient, 35-year-old male, who is lying prone on the ground with a small puddle of blood around his head. You do not notice any spontaneous movement from the patient. As you approach, an officer had a weapon approximately 10 feet away from the patient.
Sorry, can you repeat that last part? You're breaking up pretty bad. Is that my phone or your?
Sure. An officer has secured a tire iron believed to be the weapon approximately 10 feet away from the patient.
Okay. All right. PPE. Is my scene safe?
Yes.
Okay. Mechanism of injury appears to be blunt force trauma to the head. It appears I have one patient, is that correct?
Yes.
Okay. Due to his condition, I'm going to request ALS backup. And I'm going to consider C-spine stabilization. So I will have my partner hold his neck while we examine or put a collar on. Okay, general impression of the patient. I see a male in his mid-30s lying on the concrete with a puddle of blood underneath him. It appears he's got blunt force trauma and his chief complaint is being unresponsive. Level of responsiveness, sir? Sir, can you hear me? I give him a pinch to see if he's responding to pain. Does he respond to painful stimuli?
Yes.
Okay. So level of responsiveness, response to painful stimuli. I'm going to check his airway. So I open his airway. Is his airway open and patent?
Very fine teeth have been knocked out. There's a mouth.
Okay, so I will turn his head. I will suction. No, I don't turn his head because I'm stabilizing C-spine. I will suction the blood out and clear his airway. Skull. I'm gonna say I'm gonna assess his breathing. Is he breathing regularly?
With an irregular pattern, very fast and very slow, and a period of apnea, and then he repeats that.
Okay. How's his chest rise and fall?
I do not have that.
Okay. I'm gonna listen to his lung sounds.
Those are clear.
Lung sounds clear. Okay. And I'm gonna go ahead and put him on oxygen. I'm going to forego an airway adjunct because of the possible skull fracture. All right. I check for. I'm checking his pulse. Is his pulse rate rapid, slow?
Pulse is 58 beats per minute.
Okay. So it's on the slow side, and is it strong or weak?
Do not have that information.
Okay. I'm looking for signs of major bleeding. Are there signs of major bleeding?
Let's see. Bleeding from ulceration on the back of the head.
Okay.
Venous bleeding, no gushing or spurting.
Okay. I am checking his skin condition. Is it pink, warm, dry, pale, cool?
Pink, warm, and damp.
Pink, warm, and damp. Okay. From here, I would go into a sample history, but as our patient is not responsive, I will get baseline vitals. So I took his pulse. That is 58, you said. I'll take his blood pressure.
That is 186 over 118.
186 over 118? Okay, so he's got high blood pressure. All right, and checking his pupils. How are his pupils?
Unequal.
Unequal. Okay.
Yes.
I am making a priority transport, which I should have done already before getting vitals. I'm getting him in the ambulance and on the way to the hospital before I continue my secondary assessment. So I would log roll the patient onto a backboard, load him onto the cot, and remove the backboard, get him on the ambulance. On the ambulance, I would expose my patient and begin my secondary assessment. I'm starting with his head. I feel his head, palpate. Do I feel any deformation, crepitus?
You feel a deformity in the skull fraction of the left posterior skull, 2-inch laceration with deformity.
Okay. I've checked his eyes. I'm checking his ears. Any battle signs?
No.
Any fluid out of his ears?
Nope.
Okay. Checking his nose. Any fluid coming from his nose?
No.
Okay. I've checked his mouth already. I'm palpating his C-spine. Do I feel any deformation or anything notable there?
No.
Okay. I'm checking for jugular vein distension, for tracheal deviation. Anything noted?
Nope.
Okay. I'm going to move on to the chest. I palpate his chest.
Abrasion and bruising to the left shoulder area.
Left shoulder area. Okay. I listen to his lung sounds. I'm going to palpate his abdomen. Is there anything noted in his...
Stable pelvis, abdomen soft and non-tender in all 4 quadrants, no genital injury.
Okay. Checking his genitals. All right. His lower extremities. I'm palpating there. Anything notable?
No major injuries, PMS present, all 4 extremities.
Okay, so he's got pulses in his feet. All right, upper extremities, feeling for pulses again. And palpating.
All good.
Okay. All right, I would have checked his back and his posterior when I log rolled him onto the backboard. So I would have felt his spine and posterior as well. Anything noted there?
No.
Okay. At this point, I would reassess every 5 minutes and try to meet up with ALS or get him to the hospital as quickly as possible.
Cool.
And I think I'm done.
All right. And then reassess every how long?
Reassess every 5 minutes.
And then oxygen or no oxygen?
I had put him on oxygen back at airway and breathing. I think I'll have to watch back at the video. Maybe I didn't.